I'm Mohammed Tayeb. I'm the co-founder of MedicalChain. We are a blockchain-based company operating in the medical space. We're effectively building software to empower patients to have access to their health records. And I guess I'm here today to take you a bit through a journey of where we've been and a bit about the healthcare space and medical records, if you don't know about them. So, and I've got my colleague with me, Tayeb, who's our health informatics manager at MedicalChain, who will cover some of the technical things we're working on as well. So, this is a survey that was done, I think it was a couple of years ago, which is known as the Trust Index. So, when people are asked typically on the street, which profession do you trust the most to tell you the truth? And doctors and nurses always come up at the top. And if you're in any of these categories, unfortunately, you're not very trustworthy, according to the Trust Index. And this is updated, all the time. By the way, you can look it up. But anyway, so doctors and nurses are some of the highest, most trustworthy people in society, and of course they would be when you are trusting them with private personal information and taking their recommendations for medical aspects and medications to take. Yet another research which was done by Johns Hopkins University in the US found that medical records is the third leading cause of death in the United States. So medical errors, the third leading cause of death in the United States. That means you're more likely to be ill, walk into hospital and die from a medical error as opposed to being shot in the street in the US. And the reason for these medical errors is not because these doctors and nurses are being malicious or they are maliciously creating errors to kill you. The real reason is that it's about poorly coordinated care, and doctors not knowing where you've come from or your previous medical history or what medications you were on when, like for example, you could be in an emergency room or in accident emergency, as we call it in the UK. The doctor doesn't know you're unconscious. They need to give you a penicillin shot, but they don't know you're allergic to penicillin, and that could have a bad reaction. And there are so many examples of this that happen. There have been examples of people operating on their own kidney, or other things in your body, the wrong knee. When you're unconscious and doctors working on you, you can't say no, it's the wrong one. It's the one you need to be working on. And essentially, what it comes down to is access to information. That information being passed on, and it goes lost, goes missing. Sometimes people just make a decision. That decision is wrong. In the NHS, the NHS is a great, fantastic organisation for us. It's delivered 3 of my children, and it's done a lot of things for my family. But at the same time, the NHS has got its flaws, and a lot of it comes down to data as well. So I'll show you some doom and gloom slides of things that happened in the NHS, and these are news stories. So rather than me writing bullet points for you, you can see them for yourself. This is a story about a breach that affected 26 million NHS patients, a security breach. A lot of you will remember the ransomware attack that we had that locked computers in the hospitals. So my co-founder is a doctor in the NHS, the CEO of MedicalChain, and he himself was working in a hospital that had its system locked out, and he had to physically send patients home because he couldn't access their data. Operations were being cancelled. Other kind of appointments, etc. couldn't go ahead because computers were locked out. This is a story from February 2017 where the NHS misplaced 700,000 medical records. Again, something that commonly happens, doesn't always get reported, but when it does, you will see. If you go and look at Google these sort of titles, you will see that they're happening all the time, and not just in the UK, they happen all over the world. There have been examples where a hospital in the US, for example, gets burned in one of their thunderstorms, hurricanes, sorry, and all the medical records go with it. So it happens quite a lot, and your medical record is worth more on the black market than your credit card. details or your bank information. And the reason for that is if you lose your credit card or access to your bank account, you can simply go and get a new one, probably claim your money back, and off you go. But if your medical record has a lot of sensitive information that you cannot undo or reproduce and change your identity, this is your identity. So if you lose that, you're forever at risk of being exposed to hackers. Another thing to consider is who is accessing your data, your very valuable data, when it is sitting in centralized systems in these hospitals. So many of you will be familiar with this gentleman, Hammond, who used to present a program called Top Gear. He's someone that's prone to having accidents, and in 2006 he was trying to break the land speed record by driving the fastest car possible. And unfortunately this resulted in a nasty accident, and he had a lot of broken bones and he was admitted into hospital. There was a media storm outside the hospital. He was there for about a month. Everyone wanted to know what's happened to Richard Hammond. Is he okay? People wanted to hear gossip and updates, and so he was fine. Thankfully, he came out. He came out okay. But when he did come out, there was a story about an investigation in the hospital which found that nearly 33% of the doctors and nurses in that hospital had access to Richard Hammond's medical records while he was in the hospital. Now, he was in a very big hospital. It's impossible for 33% of the staff there to have been treating him. He was probably only being treated by a couple of consultants. But it just shows that these guys, they weren't. I'm not going to say they were trying to sell his data or anything like that, but clearly they were being nosy, and they shouldn't really be looking at his records because ultimately they are his personal records. So your medical record or let's say a version of your medical record probably sits in your local hospital. There'll be a record with your family doctor, your GP. There'll be a record about you if you've been to see a consultant privately, let's say, or even a general consultant. And even if you've got private health insurance and that one time you made a claim and went to a private consultant in a hospital, they will have some kind of record about you as well. And those records today are not joined up. Even your GP record isn't in the hospital. So if you always go to see, if you always go to the same hospital, you might not have suffered from this. But if you've travelled around and you go to another NHS hospital in another county, let's say, or another city in the UK, other than your name and date of birth, they're not going to know anything about you, and quite often your information will have to be either physically transported by snail mail or faxed over to that other hospital if information about you needs to be transferred. And this is, even though everything's under one umbrella, the NHS, etc., unfortunately a lot of it is disjointed. And one of the main reasons for this is because they use different software vendors to hold this data. The data is centralized to that hospital or that GP, and they don't talk to each other for various reasons, legacy reasons. The software vendors haven't moved on with the times to make that data very interoperable, and they're profiting from that, because what's happening is they're making these hospitals and clinics effectively, they're holding them ransomed, or they're holding their data ransomed, because the cost of change becomes more expensive as the years go by. So you might, so we've established that your record could be in any of those places, but then also having access to your record, it's not just you or your doctor who may need access. It could also be your employer or your health insurance provider in the future, or even now they may request access to your health record if you take out a life insurance policy, for example, as I did recently. If you are elderly or vulnerable to a situation and you have a social worker or someone looking after you who also needs access to your record, that's also possible. But again, if your record is sitting in different organizations, or different versions of your record sitting in different organizations, you're never going to have that single version of the truth. So this is what we are trying to do at MedicalChain. We're trying to pull together your different health records and effectively put them on a single ledger that gives you access to your health record, and puts you in control of who can access your health record and for how long. So we are using blockchain technology, and the blockchain technology I'll talk more about blockchain technology in a minute, but blockchain technology isn't storing the health record, it's managing the access to the health record, because your health record can become large bits of data, potentially gigabytes of data, and that's not possible to store on a blockchain in an efficient manner. So what this will do is, traditionally, healthcare has always revolved around the family doctor, and the family doctor has always been in control of the situation. They know you, they tell you what medications you need to be on, they tell you which consultants you need to see, etc. And I think right now, society today, people are becoming more and more aware of their health and taking more control of their health and wanting to make their own choices. And so we are ever more now moving to a patient-centric approach in terms of healthcare. A lot of you will be carrying devices that collect data about you, your heart rate, your movements, etc. And so you're now more aware of how you're feeling today, or when you should be taking action. And so it really should come down to the patient and their own control. And also when you travel today, you take so much information with you, like your phone, your emails, your calendar, your photos, your music, your Dropbox, your files on Dropbox, etc. You've got access to all of these, but your medical record, which is probably one of the most important things, particularly if you've got a chronic disease or something, that will stay typically with your family doctor, and that's not something you take with you. But that's something that's so important that you should also be concerned about. So typically, data is held in centralized manner. Centralized manner means that you've got a single point that holds this data, and that's a single point of failure, effectively. So in this case, this could be your GP, and these are all the patients, and basically the GP holds all the information. So if they, or let's say these are not necessarily patients, these are people who need access to the data, so everyone has to go through the GP, or this could be the hospital, or this could be your consultant. Okay, a distributed fashion means that the data, different versions of the data is held in, the same version of the data is held in different places, so that way you have multiple ledgers that control the access and verify this information. So currently, in a healthcare system, what we have is multiple centralized silos of this data. So if you imagine, these are different hospitals and GPs are holding data, and your data can be sitting in a multitude of these locations. So you've got to go and get access to the data in multiple places to be able to pull it. Whereas in a distributed manner, that would not be the case. And we are not going to change the world tomorrow by doing this. We are miles away from getting there, as a society. But we have to make a start somewhere, and we believe we're making the right steps towards that. And eventually, governments need to, of course, wake up to this and adopt standards and push for standards rather than just say everyone should have access to the data for us to be able to get to this kind of distributed fashion. So what is a blockchain? I don't know how technical you guys as an audience, but I'll just assume you're not, so I'll just talk about some basics. So distributed ledger, that's based on cryptography, and what we want out of it is as mentioned here, transparency, robustness, reliability, trust. Effectively, blockchain is historically known to power Bitcoin. Bitcoin is the most famous example of blockchain technology. It means that there are different nodes that agree on consensus, and they agree on the version or the structure of data that's stored on that blockchain, on that node. You cannot change information on it unless there is a consensus. So that way, everybody agrees when there's been an update made. So bad actors can then be removed. Now, in the case of health records, what could be a bad actor? We're not saying that people are malicious or that hospitals are malicious or in some way, but throughout a healthcare journey, things can go wrong. So, for example, a doctor sends in a letter to a hospital, or you send in a payment, or your blood tests have been done and they've been put on the system, things go missing. You could be up against a doctor or a hospital where they say to you, actually, we didn't receive those results, you need to come back and do a blood test again. Or we don't have a record of that last time. But that could just be on their system. But when they look into the blockchain and they see that actually something did take place, it's their system that's not updated, or it's their system that's gone wrong, then you are not to blame. I mean, just to give you a simple example, you might go to an NHS doctor, and the NHS doctor will do an X-ray for you or a blood test. You will have the results of those, and then you have a long waiting list before you see the next consultant that you're recommended to see. So you take out your health insurance and you decide to go and see a private doctor. The private doctor will say, actually, I need to repeat those blood tests, I don't know where they came from. They may not necessarily take the blood tests that you've done. They may ask you to do it again. That's going to incur an extra cost for you or the insurance company. It's going to be uncomfortable for you because you have to do another blood test or another X-ray, which is quite damaging. So in a blockchain environment, you wouldn't need to do that because the data is verified. You know where it came from. You know it can be trusted. You know that when you're giving a prescription to the doctor, or when you're telling a doctor, I need to be prescribed certain information, a certain drug, you're not a drug. You're not presumed a drug addict until you can prove that you actually need that kind of drug. So blockchain storage versus traditional servers. Again, we don't store large amounts of data on the blockchain, but any data that we do store needs to agree. You can't have different nodes on a blockchain that don't agree or have different sets of data. The data has to be in the same structure, in the same format, and it has to agree. Traditional servers have single points of failure. So if a server in a hospital isn't backed up properly, or if you have a virus that goes in and deletes lots of data or maliciously corrupts it, and that wasn't looked after properly, there were no backups, or the place burnt down, then that single point of failure fails, and so you lose access to that data. But with blockchain, as long as you have your keys, you can access it. Even if it disappears, you get a clone from another node, and you can still have access to it. So blockchain is quite, last year it was a really big buzzword. It went up quite high. This is the Gartner hype cycle, which I don't know if you're familiar with, goes through different technologies and shows you where they are right now on the hype cycle. So right now it's kind of going down a little bit, where people are realizing that blockchain is not necessarily the solution to the world's problems. You really need to kind of evaluate, do I really need a blockchain to solve this problem? We think that use of blockchain is great in healthcare, but not necessarily in other industries. So right now I think it's kind of trending downwards a little bit, according to Gartner anyway, in terms of hype, until we see some real world applications that are being used on the blockchain. Because right now there are many companies like us, there are many companies who are out there proposing solutions on the blockchain, but have yet to materialize those solutions. This is a blockchain decision tree. Take a photo of it if you like. It's something interesting. If you're evaluating the use of blockchain in your industry or in your business, it's something interesting to look at, because it gives you a bit of a reality check whether you don't need a blockchain, or you might need a public blockchain, or you might need a permissioned blockchain. So if we went through this, we come out with you might need a permissioned blockchain, which is different to a public blockchain. So, as I mentioned, the way things work, and I'll invite my colleague Dave to give you a bit more of a technical overview of how we store data. Essentially, we store hashes of data. So the data is encrypted, the hash of that data, the hash simply means it's the fingerprint of that data. And so it's not the entire data, it could be a random selection, or if you're taking the rule, it could be a random selection of that data stored in the hash. So if the original data was modified, that hash would look different. And all you're doing is checking that data has not been changed, and it's originally exactly how it was when it was encrypted and the hash was stored on the blockchain. That's effectively what this diagram symbolizes: a method to hash the data and a method to compare that hash with the origin. And of course, it wouldn't be right if we didn't have any challenges ahead of what we're doing. So I'll pass this on to Dave, and he can talk about some of that and also the applications that we're building.
Thank you, Matt. Good evening, everybody. Tayeb is my name. I'm Head of Health Informatics at MedicalChain. Informatics, just in case you don't know this word, in the health sector, IT equals informatics. For some unknown reason, health has a different name for IT. And I actually started, after leaving university, I worked in the NHS for a couple of years on the psychiatric health side, mental health, and then I switched into programming and worked all my life in IT, mainly insurance and financial services, but I spent in the early noughties 3 years as head of IT at a large hospital in Manchester, Salford Royal Hospital, and I went back then into financial services, but it really lit an interest in the whole issue of health IT and what is wrong with it, because it is seriously wrong, rest assured. If you compare it with other industries, I was working through the 90s, watching consolidation, integration of systems, moving from large organizations having 30 or 40 systems with very poor interfacing, moving on to single platforms where everything worked in harness. Now, for some reason in health, that hadn't happened in the early noughties. I mean, in the hospital I was in, we actually counted 150 software applications, the majority of which did not exchange any information. And it's reckoned that these days there will be over 400 applications in any hospital. This is where you have the silos of data that Mo mentioned. And having the fragmentation of that data is really damaging to the health enterprise. So anyway, I had that interesting 3 years, went back into financial services. 3 years ago I was at a point where I could actually go off and pursue my own interests more, and I had this idea to go back into health and to have a look at this problem, which I quickly established hadn't really moved forward, still all the silos, even more of them, still this really big problem, nobody really fixing it. And 2 years ago I actually came across this idea of blockchain, and it clicked that maybe this could make the difference. So I worked for about a year working up a project on that, making very slow progress, and then I met MedicalChain, who had raised their funding through an initial coin offering, so funded, always helps, and who were further down the road in terms of implementation. This was just a year ago yesterday I joined, actually. So I'm a year in this startup, having a really interesting time working with blockchain, working with health, all the things that really interest me. Anyway, I should get onto these slides, so we'll be here all night. Which one is it? That one? Yeah. Okay, interoperability, all these different systems, how do we make them interoperate? One of the keys, and this is the other real kind of killer bullet. On the one hand, there's blockchain, and we've seen a bit about how with cryptography and so on, it can move the control into the hands of the patient. But the other problem is the standards over the years have been pretty weak. And what's emerged over the last 3, 4, 5 years is this HL7 FHIR standard, and it is a standard for exchanging data. So rather than have to write a new interface again and again, increasingly the software suppliers of the major hospital systems, and indeed everybody involved in health software, is actually starting to follow this standard. Makes it much easier to exchange data. Really important. However, if you think about it, the root of the problem is that all these systems have entirely different structures. If everybody worked to the same structure and it had a semantic layer that made it meaningful for the clinicians, then you're solving the problem at its heart. And that's what OpenEHR does. It's a modeling system for how to hold your data, design your data in a clinically sensible way that everybody can share. And the combination of the two, as with blockchain, is really pretty amazing. Now, that's all very well, interesting theory, but as in any startup, any software application indeed, the most important thing is understanding your use case. What is this? How is this going to work? Who's it going to serve? What are the benefits? I won't go into detail in this, but just to give you a flavour of what we're building. We have a telemedicine application, which I'll come on to a little more in a moment, My Clinic, which is already live as a pilot, went live in September, and is available. You can register, you can sign on, and if you wish to, you can have a telemedicine consultation. Now, it's actually built onto a platform which runs on Amazon Web Services, so everything we build is in the cloud. And that's normal these days. I don't think any startup normally would go down any other road, especially since Amazon, Microsoft with Azure, and also Google now have the certification to be able to really support the security and the confidentiality that's required for all industries, but especially health. So we're building everything there, and the blockchain, it controls the access. It manages that, but the actual health data is off-chain on this OpenEHR standard. You can see the blockchain out on the right, and the decision that MedicalChain made was that Hyperledger was a good platform. Interestingly, I'd already reached that conclusion as well, which is one of the reasons I joined. I thought it was absolutely sound. I don't know if any of you know the history, but IBM, going back 4 or 5 years, actually spent a lot of time and resource on building this Hyperledger platform. And the idea is that it would be ready for enterprise. It's permission, not public, so it's aimed at large organizations, but it has the scalability and all the features you'd expect of an enterprise system. And obviously, if we're talking health, if you're ambitious, you know, we've got 65 million people with health records in the UK. That's your market in the UK. What's your market internationally? What you don't want is, okay, we started well, but then we ran into scaling problems. And once we went to 50,000 patients, the whole thing died. So scalability is very important, and permissioning is very important as well. And we could talk at length about why a public ledger such as Ethereum is probably not appropriate for most healthcare applications. That's another story in itself. What we're implementing right now is we're starting to flow the data from the general practice systems onto our platform. Now, oddly enough, in the UK, we're quite unusual in that just about all of the general practices in the UK use one of 2 systems, EMIS and TPP. So even though those are proprietary systems with different structures, there are only 2 of them. So you have the opportunity to build interface there and open up the opportunity to access over 60 million records. So that's one of the things we're focusing on. The other interesting thing is that the large hospital electronic health record vendors, and there's a big 4 or 5 or 6 in the world, most of them American, they have finally been browbeaten into building a FHIR interface around their hospital applications. It's been a long, hard road. It's against their business model because obviously they have a cash cow. Once a hospital spends 100 million, or in the case of Cambridge University Hospital Trust recently, when they moved onto the Epic system, £200 million just to get across onto it. You won't be leaving it in a hurry, and you vendor locked. Okay, but they're now starting to actually build this wrapper around the systems so that you have the opportunity to start to pull the data off. So we're working on that as well. On the blockchain side, you do need multiple nodes. However, you start with one in-house Genesis node, and what we'll be doing over the coming months is establishing partners who'll be willing to host the node, whether it be hospitals, universities, whatever. Once you get to 5 or 6 nodes, that can run a consensus mechanism, so you get all the benefits of immutability and all the good things that the blockchain brings. We also have a token because we ran an initial coin offering. As euphemistically, I came in at the end of that process, and that introduced a token, Med Token, which is another very interesting aspect of all this, because a crypto token, is a means of exchange that can open all sorts of interesting angles to how we deal with the value in the healthcare systems. I was listening to a podcast on the way over, actually, interview with Joe Lubin, who's a founder of Consensus, who were involved very early in all this. And he was saying one of the most interesting things about healthcare for this is that it's going to be possible to handle the grant of permission for somebody to use your data as an asset on the blockchain. So if you want to be involved in clinical studies, research, whatever, you can make your record available through an infrastructure, something like this, with absolute anonymity and security, and you can earn value back, whether to spend or to donate or to use for health services or whatever. And you see over on the right here, a very important source of value is research and the pharma companies and so on, who have a lot of difficulties accessing useful data for the studies. And the combination of the standards and the blockchain, I think, is going to really change that. And the idea is also this is a platform that will be opened up for developers of apps, applications, to actually build onto it. Applications. Okay, so I mentioned my clinic. You can make an appointment, after this meeting, go onto my clinic, have a look, register, have a look at the appointments. You don't have to take one up, but it's interesting just to see, I think. And after the appointment, you'll be able to see the recording of the appointment with your doctor, just like that on health, really, but with somewhat different infrastructure behind it, and also done working with the GP partnership, which is in Richmond, I believe, the Groves partnership, and as opposed to Babylon, which has had some pretty serious issues. It's seen as creaming off the well patients and leaving the sick ones with the GP practices. So coming at that from a slightly different perspective, and I think a better one. This is what it looks like. All good, nice user interface. This is a practice in Kingston, Richmond. I'm not a local, I think they're very close. So.
Well, there's 4 practices. So there's Kingston, Richmond, Esher, and Wimbledon.
Yeah. Okay, so we're unlocking the GP data, and when that's available for the patient to look at ahead of the consultation, I have slightly high cholesterol. Otherwise, I'm disgustingly healthy so far, but I like to keep a track of it, and I can now look at my blood results and see how's the HDL, LDL going, and all those good things. Starting to take control of my data. And you can also pay in cryptocurrency if you want an adventure as well. Okay, so that's live. Great to have something out there in the real world live. You learn a lot very quickly. It is an MVP, it's a minimum viable product. It's out there as a start point, and we are developing version 2, due to come online in March. Now, okay, we've been talking about medical, we've been talking about illness, but the other side of that is health. And as we all know, we're wearing our Fitbits, and we're using consumer products to help actually manage our health and our wellness. And then, of course, the other side of that is there are a whole lot of medical devices which are wearable for diabetics, etc., etc. So the other thing we're doing is, at the moment, integrating Fitbit. But that's only the beginning of that journey to bring in the medical devices and all that good stuff. Yeah, there it is. Not quite implemented yet, this one, but we're on the way to that. It's a new slide to me, so forgive me if I read it first before I talk about it. Yeah, you read it for yourselves. I agree with it anyway. There's a video that says play as well. Oh, yeah.
So if you haven't seen this video, it's on our website. But
In our world today, with the technology available, could healthcare be better?
sorry, it's very
Today,
low.
doctors, nurses, and health professionals are limited in the level of care they can provide. This is due to the inability to view your complete and accurate health record.
At MedicalChain, we believe that by putting patients at the heart of healthcare, we can truly improve people's lives.
With MedicalChain, you have full access and control over your own personal health data. Users are able to grant doctors immediate access to their health record via their mobile device. MedicalChain keeps electronic health records safe and secure using blockchain technology. The blockchain layer of MedicalChain hosts limited, non-personal information. This information acts as a pointer, directing the system to your encrypted health record. Encrypted records are held within hospitals, universities, and non-profit organizations regulated to handle sensitive data. Only your authorization can unlock your health record and allow it to be viewed on the mobile interface. But MedicalChain is much more than a way to view patient electronic health records. Services such as telemedicine consultations are available with MedicalChain. Your doctor can check your progress with access to your medical history. Wearables ensure that doctors can access life-saving information when managing vulnerable or unconscious patients. MedicalChain provides peace of mind. You can feel safe knowing your health data is accessible to you and your doctor when it matters most. We are transforming healthcare with health professionals, patients, and technology specialists from around the world. We hope you too will join MedicalChain in building the healthcare of tomorrow today.
Okay, thank you very much.